Hi friends, myself Dr. Prasanna Menon, consultant gynecologist and obstetrician attached to Currae Hospital for Women. Today I shall give a few tips on cancer in female patients, of course. So ladies, when they start typing their few symptoms, whether it is a lump, bleeding disorder, they try to use a Google to really find out what is a diagnosis. And we all know the outcome of Google. We come up with different diagnoses, whether it is cancer, whether it is not cancer, and we get totally confused and we have sleepless nights. Friends, I would say the first thing is one need to stop the use of Google to diagnose your case. Whatever is your symptom, maybe a lump in the breast or it is a bleeding disorder, we should simply consult a routine gynecologist first, try to understand what are the causes. Many a times it may not be cancer at all, and get the appropriate treatment. So coming back to the cancer, let me say, in females, the common type of cancers are cancer of breast, cancer of ovaries, cancer of uterus. These are the common types of cancer as far as the reproductive system of female is concerned. Now, out of the three types of cancer, we all know, and even the doctors would say, that the breast cancer is easy to diagnose and treat completely, and a lady can lead next to normal life. The key point is one needs to be alert. As soon as you find that there is a lump in the breast, we need to get it examined clinically, and if the doctor feels that there is a need to go for a sonomammography or mammography, one should go for it at the earliest. It may lead to another test like maybe an FNSE or a biopsy, which will give us further confirmation as to what is the type of cancer that one is having. Now, after doing the biopsy, we also get to know the grading of cancer, the staging of cancer. All these things will be very important, which will tell us as to what will be the prognosis of a given patient. These things can be discussed in detail with your consultant and a team of consultants who will guide you appropriately. Similarly, in case if we find that there is an unusual abdominal distension, we should go for an ultrasound of pelvis and abdomen, which will tell us whether we have any ovarian tumors. Even sometimes if it is so big that clinically also doctor can examine and find out that there are ovarian tumors. There are various types of tumors. They need not be cancer or they need not be malignant. They can be benign, that is non-cancerous, or they can be malignant. Once an ovarian tumor is diagnosed, there are some blood tests called as tumor markers which are evaluated. MRI scan is taken and further guidance is given. The treatment will depend upon the type of tumor, the stage of tumor, whether a surgical management or a radiation or a chemotherapy that a counseling team will be guiding a patient. Coming to uterine cancers, there would be bleeding disorders. Not all bleeding disorders indicate that there is cancer. It could be simply a hormonal disorder which a doctor has to find out for you. So once a doctor feels that look, it is pointing towards a cancer of uterus, she may advise a DNC, which is dilatation and curettage, maybe a hysteroscopy, a small biopsy of the endometrium is taken, sent to the laboratory, and we wait for the result. Sometimes it may even be simply early stage of cancer, or it may just be a benign thickening of an endometrium. So depending on the cause, it would be treated. Now, sometimes it is just proliferative endometrium, thickened endometrium, which says that it can be responsive to the hormones that is given. Then there are various hormones, or probably maybe a T, that is levonorgestrel. IUD can also be inserted in the uterus and the bleeding disorder can be taken care of. Now, these are simple tips which I am trying to share at a level not very scientific, at a level where a patient can understand that not all bleeding disorders will point towards cancer. And the type of cancer, the stage of cancer will decide as to how much a patient will be benefited with the given treatment. All that one needs to do is, in case of a doubt, get in touch with your trusted gynecologist around, let her diagnose as to what the situation is. And one simple request would be, please do not put your symptoms into Google and try to arrive at a diagnosis, because it would misguide you. You will have sleepless nights. Thank you, friends. For any further queries, you may get in touch with me or any consultant with Currae Hospital. Thank you. Have a good day.